Welcome. Welcome. Yeah, just one more second in terms of logging in here. Okay, so I want to welcome everybody to the Precision Point Diagnostics educational series. We're gonna start off with looking at oxidative stress and brain health. Next time, we're gonna look at more food testing and pediatrics, and we're gonna cycle through various topics once a month. Check the precisionpoint.com homepage. You will see the educational events listed there. Also, we do have our once a month Q&A time where you can just log in and ask any questions about who your patients are and their test results and things that you might want to know. And we will be doing one of those not this Friday, not next Friday after Thanksgiving, but the Friday following around 3 p.m. So check back on the dashboard, check back on the homepage, and you'll see various opportunities for continuing to learn about Precision Point and what's going on. In addition to that, now's a good time to be following us closely because we are releasing a whole bunch of new profiles, really focusing on more comprehensive wellness screens, like, for example, a test profile that gives you your CBC and your Kim screen, but also gives you a complete thyroid analysis, also gives you serum hormones, also gives you markers such as vitamin D, B12, folate, hemoglobin A1C, CRP, looking so we can kind of figure out what direction should we take the patient in next. We're also going to be releasing lots of really exciting bundles at very good price points, like, for example, a test that allows you to look at reproductive hormones, adrenal function, and thyroid all at once, because we know that adrenal axis is what we really need to look at all at once in order to treat effectively. Today, I want to jump in terms of talking about oxidative stress and brain health. And we have had this oxidative stress profile for many, many years, but I think that it is probably underutilized by our clinical selves at large. And the reason I think that it's probably underutilized is because many times in our Western diagnostic system, we are thinking about a test to confirm a particular diagnosis. And on the oxidative stress profile, we look at markers such as glutathione, 8-OHDG, F2-isoprostane, and I'll get into more detail about what all of those are. But I say that because glutathione, is not a particular diagnosis, but it can make many conditions worse. And particularly when we look at the health of the brain, we know that it's highly reliant on antioxidants. And this is for a number of reasons. We know that the brain uses an unusual amount of glucose, especially especially when you compare it to the activity in our other organs. And we know that even though it uses such a high amount of glucose, and even though it uses a very low amount of oxygen compared to the rest of the body, it still generates a very high amount of reactive oxygen species. And so, unlike the liver that's loaded with antioxidant response elements, things like glutathione peroxidase and superoxide dismutase, and higher levels of glutathione in general that keep it more reduced, our brain is more fragile in the face of oxidative stress. And so, as we look at the data, there's a very strong association with oxidative stress tracked through these markers and depression, anxiety, bipolar, even schizophrenia. But yet we aren't in the habit of always looking at them all the time. And I think that it would improve the clinical course if we made these more front and center when we're dealing with somebody with a cognitive issue, because of course we will do things like change their diet and help them to eat more organic foods, which should lower free radicals. We might even use supplements like N-acetylcysteine or S-acetylglutathione or sulforaphane plus myrosinase that all increase the activity of glutathione peroxidase, that all decrease oxidative stress in the brain. But which one should we use? And how much should we use? And if we need to decrease oxidative stress in the brain, do we need to use all of those, one of those? And really the only way to answer that question is by looking at levels. Are we getting tissue saturated? Are we producing enough glutathione to control that pathology in that person? And so when we look at these markers together, both levels of glutathione, but functional markers of is it enough for that person, like 8-OHDG and F2-isoprostate. This is what really allows us to hone our therapy and know when to overlap, when to use more than one thing, and how long we want to use it for. So the brain is uniquely susceptible to oxidative stress. It needs a lot of glucose. It uses oxygen, but it doesn't have a lot of ways and pathways to keep those things in a more reduced form. And so what we know is that the brain, and much research has talked about how we know that the brain is uniquely susceptible to oxidative stress. We know that the brain has a higher level of fatty acids than other tissue. If you think back to cadaver lab, you remember it was practically like a bad Jell-O mold that somebody brought to a Thanksgiving party, highly fatty. And so those fats are more susceptible to peroxidation. We know that the brain consumes 20% of our oxygen, but yet it's only 2% of our body weight. And we know it's not really enriched with antioxidant defenses, even though, yes, there is glutathione peroxidase, like I mentioned, not nearly the level that maybe the liver has or cardiac tissue has. So much lower antioxidant activity compared to other tissue, even only 10% of what the liver is able to do. This is pretty clear, right? You could have a drink or two tonight and your liver enzymes aren't going to go up, but mentally you could feel it from that. Also, our brain has higher levels of iron, so that is easy to oxidize. So another reason it's more susceptible to all of this oxidative stress. And so as we look through the literature in terms on how do we change depression, you'll see a lot of discussion of things like sulforaphane, classic antioxidants that come from broccoli sprouts. And so in this model of depression, they actually use lipopolysaccharides to induce depression in the mice. And the reason they do that is that LPS will increase more inflammatory cytokines and induces a model of depression. And here, using sulforaphane, it was able to check against that. So this makes a couple points to us. First, lipopolysaccharides that are formed in the gut play a role in depression. And so I'm going to talk to you about something called our GDAP profile that combines our intestinal barrier assessment with our oxidative stress markers. This is a really nice one too for analyzing root cause of depression, but also just makes the point that gut-based dysbiosis can be a big part of depression. And when there is more dysbiosis, it creates more oxidative stress. It's one of the major ways to get there. The more you deplete glutathione, the worse and worse the brain does. In this model, LPS creates an inflammatory response, and that depletes glutathione. So again, a connection between what's happening in the gut and what is happening in the brain. And this piece even talks about if we give antioxidants early enough, stimulating NRF2 to keep the brain more reduced, then we'll not only prevent depression early on, but makes people more resilient in adulthood too. So this thread of lowering oxidative stress becomes really important to what's going on. Another reason that we will see more reactive oxygen species, more issues in the brain, is because as our belly gets bigger, as we have diet-induced obesity, this causes higher levels of reactive oxygen species that promote cognitive impairment. And so what we know is that our diet can even impair glutathione peroxidase activity in the brain. And so thinking about cognitive decline as a metabolic issue can also be useful. So this is why on our wellness panels that we've just introduced, you will always see hemoglobin A1C, not just so that we can figure out when someone's pre-diabetic or diabetic, but if that is above a 5.2, we know that that's associated with a decrease in cognitive function, with the brain even shrinking. And so want to give a screen of that kind of right off the bat. And so as we reduce that oxidative stress, we see more neurologic protection. And in this study, they were using alpha lipoic acid to do that because it does cross the blood-brain barrier. But again, it makes the point that we need to lower the oxidative load in order to protect the brain. But how do you know you're there? How do you know the level of cognitive decline that they're having already, that the therapy that they're on controls that amount of oxidative stress? And we don't really know unless we're looking at benchmarks to tell us. Otherwise, we risk just layering more and more antioxidants, more and more phytonutrients, costing the patient more through supplementation, and not being as directed as we could be. So really understanding the levels of things like glutathione and markers of oxidative stress become quite important when we're dealing with various conditions of the brain. So I wanted to start off with this case study where we're looking at a patient who's complaining of OCD, depression, and anxiety. And what we see are some of the common things, that there's also a decrease in some of the thyroid function. So our wellness panels always include a complete thyroid panel on them as well, but do take a minute to look at our thyroid panel. So we have it with reverse T3 and without, always with free and total T3, TSH, as well as thyroglobulin antibodies and TPO antibodies, and really very price competitive. I think what you'll find is that our cash pricing is generally beneath somebody like a LabCorp or a Quest. So reach out to me if you would like to see more about that. Again, we have just released some of these profiles, and really our goal is to make them as price competitive as possible. The reason that we want to do that is because we know that bigger labs out there aren't doing clinician pricing anymore. Insurance isn't covering things, and it becomes more and more important to have the lowest cash prices out there. So just shoot me an email if you would like to get a recent fee schedule and hear more about those. Very excited about the release, and you're going to hear me doing more talking about some of these profiles as well. So info@precisionpointdiagnostics.com for more information in terms of that. But yes, so I point this out to say, while as much as I'm talking about oxidative stress and being a reason for depression, we know it's not the only reason for it, that you could have low thyroid function, that you could have issues in terms of methylation. So having some profiles that look at all of that together can become really helpful to know what is the cause of this patient's depression. So we do things to help in terms of improving the amount of thyroid hormone, but also using therapies in this patient like selenium, because it will increase glutathione peroxidase, which is both in the thyroid and in the brain. And spoiler alert, we're going to see that this patient has very compromised glutathione, and that's part of the reason that he's feeling more OCD, even schizophrenia and depression. Double spoiler alert, as I backed down some of his antioxidant therapy, he started hearing voices again, and so pulled it back in. And so you would see a very nice tracking in terms of what was required for his level of glutathione to stay normal. He just needed more support than somebody that wasn't suffering from these pathologies. And the literature speaks to that. It talks about in a patient who's experienced more depression or anxiety, their brain tends to be more fragile in the face of oxidative stress. Part of the pathophysiology in the first place is a downregulation of glutathione peroxidase. And so really understanding their level of reactive oxygen species is part of treating the pathology accordingly. So when there's higher levels of oxidative stress, not only was there lower levels of brain-derived neurotrophic factor, but also decreased levels of actual thyroid hormone. So selenium will increase glutathione peroxidase, and selenium is one of the things that will improve your percent reduced glutathione. And we're going to look at the profile. We're one of the only labs that tells you, do you have adequate levels of total glutathione, but do you also have adequate levels of reduced glutathione? And that's important because, for example, in autoimmunity, there will be a normal, there's a trend and a discussion in the literature about how there's a normal total glutathione, but there's a decreased percent reduced glutathione, and we treat it differently. The way that you move glutathione back to a reduced state is to use things like zinc, to use things like selenium, to use things like alpha lipoic acid that will help to move it from an oxidized form back to more of a reduced form. So in this patient's results, what we saw was that he had very low glutathione and a high 8-hydroxy-2-deaguanosine. The abbreviation for that is OHDG. And so this is an example of what a test report would look like. This was not where he was at. In fact, he had lower levels of total glutathione, and he also had lower levels of percent reduced glutathione. But this becomes a nice profile for a number of reasons. So again, like I was mentioning, you could have a decent level of glutathione, yet yet, despite having a decent level of glutathione, your percent reduced glutathione is lower. And so that's a common trend in autoimmunity. We use up the glutathione at a more rapid rate. So if our total glutathione is lower, we're probably thinking about our building blocks, things like N-acetylcysteine. Maybe we're thinking about turning on genes that make more glutathione, sulforaphane, like I mentioned before, from broccoli sprout extracts. And I really like to use one that has the myrosinase in there because myrosinase increases the absorption about fourfold. But that sulforaphane plus myrosinase crosses the blood-brain barrier very easily, influences glutathione peroxidase, has specific research in terms of depression or anxiety, even cognitive decline. But if your percent reduced is low, what you want to do to increase that is things to recycle it more quickly. And those are different therapies. Alpha lipoic acid really shines there. Selenium really shines there. And so we're reaching for different things depending on where we are at. Now, of course, one part is how much glutathione do you have? But let's say your glutathione was here, and even your percent reduced was in a healthy, normal range, but yet these markers were still elevated. So what that tells us is, yes, you have a good, healthy level of glutathione, but it's not enough for your system. So what we see here is, first of all, 8-OHDG, and that's a marker of DNA damage, 8-hydroxy 2 deaguanosine. And so that guanosine, like DNA, and so so those adducts that we form in the DNA, when there's more damage to the DNA, 8-OHDG goes up. It goes up as a byproduct, a mechanism of repair. Well, so we know that more damage to the DNA creates mutations, and so that's a risk in terms of increasing rates of cancer. And in fact, when you go to the literature and look at 8-OHDG, you see over 1,000 studies that talk about when 8-OHDG is higher, we're more at risk for cancer. When 8-OHDG is higher, if we were to get a cancer, it's more likely to be aggressive. We're more likely to have metastasis. We're more likely for those cancer cells to cross the blood-brain barrier. We're more likely for that cancer to have higher levels of angiogenesis and higher levels of cell turnover. So each step of a cancer process, the higher the 8-OHDG, the worse and worse the risk of that becomes. There's tons of research in that capacity. But again, what 8-OHDG is telling us is that the DNA of the nucleus and also the mitochondria are overwhelmed. There's too much oxidative stress to keep our genetics in a nice, healthy environment. And that could be mutations, but again, we'll also see an association of increased 8-OHDG in the research, not just in terms of cancer, but even before that, it goes up from various toxins. So there's an association of heavy metals being high and an increase in 8-OHDG, but also, for example, mold aflatoxins as well. So mold can trigger a high 8-OHDG. And this, again, it tells us, is it so much aflatoxin that your body is getting damaged from it? Functionally, how are you handling it? And so the solvents and the benzoates and the plasticides and the xenoestrogens, all those toxins as well can increase 8-OHDG. But it's also come forward that high 8-OHDG is associated with a decrease in mitochondrial function. And again, the reason for that is that when 8-OHDG goes up, part of the supply is not just from the nucleus and the DNA, but also from DNA in the mitochondria. So we'll see more mitochondrial dysfunction when 8-OHDG is high. So again, when we're thinking about neurologic conditions where we know we have to have healthy mitochondria, are we controlling reactive oxygen species? Are we controlling reactive nitrogen species enough that 8-OHDG is staying intact? And so when we look at this marker, it tells us, even if they're on an organic diet, even if they say to you, I don't need antioxidant support because I'm drinking green tea, I'm eating blueberries, if this is elevated, it's not enough antioxidant for their system, for their own health. The reason that we know that this is particularly important is, for example, that same sulforaphane I keep mentioning. When we look at the cancer data, more is better. Yeah, and you could have a patient that says, yeah, I get some broccoli every day, but getting more of that sulforaphane is going to have more of an effect in terms of increasing apoptosis. We want more of that, but how much? Do you just keep taking more pills, more pills, more pills, more pills? Or can we measure these things to understand when are we getting into that range that's controlling the health of the tissue where a person feels where they're more protected? Okay, so one of the things that you might have just heard is that 8-OHDG can go up because of many toxins out there. So you might be thinking, well, how does that help me clinically? Now, I don't really necessarily know what they're reacting to. But again, many times there is this we're working with a patient who might be very fragile. Maybe it's a Lyme patient and they've had a history not only of chronic Lyme disease, but they've had a history of a lot of use of antibiotics as well. And we know both the Lyme and the antibiotics can damage the mitochondria. And so how do we know if it's time for an antibiotic break, or what's going on? Well, if we see an elevation of 8-OHDG, again, it can tell us about poor mitochondrial function. And so we might not know if this is elevated because of mercury or mold or antibiotic toxicity. But if we begin to treat and it comes down, now we know that that patient is more protected. And many times what we're thinking about clinically is how do we build this patient up first? So I like this marker because many toxins will increase it. And so now I can use my therapies that are good at detox in general. We know that, for example, even if I prep a patient with glutathione before collecting mold aflatoxins in the urine, they excrete more of that. If I prep them with more glutathione, they're going to do better in terms of detoxification because those thiol groups help for example, a chelator and a metal to stay more tightly bound. And so if we're trying to say, okay, when would somebody be ready for more chelation or more aggressive detoxification? Get the overall reactive oxygen species down into a fairly normal range first, get them loaded with antioxidants so we're not seeing tissue damage. So then we know if there's a discrepancy between phase 1 and phase 2, they're in a nice safe zone where kicking up those hydroxyl radicals aren't going to push them over threshold in terms of tissue damage. So many times we know the chronic patient is suffering from all of these things together. And we just need to do things to improve their terrain first. Like if I'm trying, one of the major reasons cytokines run away, whether or not we're talking cytokine storm with COVID or low-level burn, ongoing cytokines from things like Lyme and mold, they'll continue to go when glutathione is depleted. So if I can get glutathione up, it is a natural anti-inflammatory. And did I get it up enough to protect the tissue? That's what F2-isoprostane tells me. That's what 8-OHDG tells me. So 8-OHDG is a marker of DNA damage. F2-isoprostane is a marker that goes up when there's more damage to the lipids. And we're going to talk about that. But different compartments of the body can be experiencing different levels of oxidative stress based on where's the infection, what toxin is it. And so looking at multiple markers, more of the DNA, is it so many toxins that's being damaged, but also looking at fats, F2-isoprostane. So what is F2-isoprostane? Well, F2-isoprostane is a byproduct of arachidonic acid that's even more inflammatory. And so when there's a highly oxidized environment, I take this arachidonic acid and I shunt it downstream to F2-isoprostane, which is no good. F2-isoprostane is vasoconstrictive, so that's issues in terms of hypertension, but that also creates microcirculatory issues to the kidney and can play a role in terms of kidney dysfunction. This highly reactive, angry fat will damage things like neuroprostanes. Well, neuroprostanes are made from DHA and are part of help us in terms of focus and concentration. If you give omega-3s in an environment where F2-isoprostane is high, those omega-3s themselves will become oxidized and they're not able to get incorporated into the central nervous system, into the myelin sheath like they should. So if you've been exploring a lot if you've been using a lot of fatty acid therapies and you're not seeing people shift like you would expect, then I would think about what's the environment those fats are in. Is this F2-isoprostane high? If so, they're not not going to be getting the benefit from the omega-3. They're not going to be getting the benefit from the phospholipids that we might be utilizing, like phosphatidyl choline, to help in terms of brain health. So if F2 isoprostane is high, then that means the fats in the brain will be in a compromised state, the fats in the myelin sheath will be in a compromised state, and the fats in the membrane will be in a compromised state, which means good healthy fats do not get incorporated in. Hi Lynn, thank you for joining. And yes, I will send you the slides, absolutely. And then a question about NAC as a precursor to glutathione. And so I love NAC, and I've looked at, so here I am talking about oxidative stress test, talking about things like glutathione. And when I look at what really pulls a glutathione level up nicely, N-acetylcysteine is absolutely a go-to. It's very cost effective. It's really good at moving the needle in terms of glutathione levels. And so absolutely I will utilize it. Now, interesting, you're mentioning that there's some research that talks about N-acetylcysteine inhibiting the action of sulforaphane. And I'm not aware of that, so I'll look into it. I have everybody's email from registering, so I'll send a follow-up email with the slides, and let me also see what I can find in the research with that, because my experience is really that they act more synergistically, that sulforaphane turns on genes to make more glutathione, and then N-acetylcysteine is part of the building block that does that. I use a lot of them together, and I've never seen a glutathione not respond to that. So that strikes me as odd. So I'll definitely look into it more. But often I'll talk about using both together. Sulforaphane turns on the gene signaling to make more glutathione. And if you do that, you better have the basic building block, which is N-acetylcysteine, to help it grow more. A question about using this for male and female fertility. And you're 100% right that oxidative stress can be problematic. First of all, when there's higher levels of oxidative stress, it blocks the conversion of cholesterol downstream into making more steroid hormones. So that's part of it. Then also more oxidative stress sends our hormones into more aggressive metabolites like 4-hydroxyestrone and then eventual quinones that aren't as helpful in terms of fertility. Also, if we look at it from another angle, when we say what are some of the things out there that are well researched to help with fertility, CoQ10 is very high on that list. An antioxidant. Even melatonin, very, very good research with fertility. What does it do? It decreases oxidative stress in the follicles there in the ovaries to help them read FSH better and to produce more hormones as well. So yes, when there's higher levels of oxidative stress, this is absolutely a reason for less fertility. And it's another group of patients that you're like, okay, they're trying to get pregnant. We don't want to have them on, like just every supplement, because if they do get pregnant, then we want to be concerned about interaction. So am I really getting to that right level? And another way to say this is that same sulforaphane from broccoli sprout I keep mentioning also has research in terms of promoting fertility, even keeping the placenta more reduced. And it's interesting, placenta, as it begins to fail, makes higher levels of F2 isoprostane. So it becomes more, the placenta, if there's more oxidative stress, this is a major reason it fails, and that's reflected in terms of levels of F2 isoprostane. So there's some direct fertility research with that marker F2 isoprostane in terms of seeing where they're at. But of course, before we make a baby, we would love to see good, adequate levels of glutathione, because if I'm going to have a sperm and an egg meet and divide and divide and divide and divide, that's a lot of DNA that's got to get made then, mitosis, meiosis, and on, fission, fusion, on and on. And so I want that to be in a healthy environment with more glutathione. That gives me less risk of mutations, less risk of breaks, less risk of concern there. So absolutely a higher glutathione environment can be be very useful. So yes, I will send some of those references in terms of fertility and F2 isoprostane as well. Yeah. And so there's a lot of underlying reasons why we might utilize a test like this. Also, when oxidative stress is higher, this could be indicative of somebody who's a poor detoxifier, because if I'm clearing toxins well, I'm also minimizing reactive oxygen species from them too. So both of those are important. I did just want to share with you another piece here, and that is, let's see. I want to just share a different test result that looks at this as well. So this is has markers of oxidative stress, and I really love this one. It's called the GDAP for gut and detox. And so this includes the markers I've just talked about: glutathione, F2 isoprostane, 8-OHDG, but also includes these markers in terms of more gut-based permeability as well. And and then some markers like vitamin D, CRP, and hemoglobin A1C for general wellness. So I think of this as a kind of a functional wellness screen. And why do I think of it that way? Well, again, glutathione, major intercellular antioxidant. And so when we have good levels of glutathione, we will detox better. Glutathione is also necessary in the gut lining to improve extrahepatic detox. Also, if there's more leaky gut, this creates an oxidative burst and is one of the major reasons for depleting our glutathione. If we have better levels of glutathione, we're going to reduce mutation, so immune cancer prevention. And higher levels of glutathione protects the inside of the vessel, or something called the glycocalyx. And that glycocalyx inside the vessel is what sends a signal to nitric oxide to make sure we're vasodilating appropriately. So when we see someone with like a POTS disorder or even hypertension, the opposite side, they're overly constricted, that can mean a failed glycocalyx. And one of the things that helps to nurture the glycocalyx is in acetylcysteine by increasing production of glutathione. Also, when more cytokines lodge in the glycocalyx, this is one of the major things that breaks it down. So if we have adequate levels of glutathione, it's going to keep those cytokines in check, and it's going to help vasoconstriction. Things like memory, glutathione is the major antioxidant of the brain. And so as we click through, I kind of went through and said, okay, how does this profile help us with detox, gut, immune, cardio, and memory? So F2 isoprostane, this marker of fatty acid oxidation, when it is high, it will also oxidize other lipids. It will oxidize LDL. It will oxidize ApoB, that protein on lipids that's so fragile. And in fact, one of the places F2 isoprostane ends up is in a plaque. It's an angry inflammatory fat that will upregulate ICAM or adhesion molecules and cause more basically stickiness between the fat and the vessel there to create more plaque formation. As I mentioned, F2 isoprostane is vasoconstrictive. When we vasoconstrict, it creates more shear stress. That shear stress is a direct stress to that glycocalyx. This will decrease signaling to nitric oxide synthase. Nitric oxide goes down. So now it's a reason for part of the hypertension. Of course, yeah, so like I mentioned, a plaque former, decreasing nitric oxide. And when we have higher F2 isoprostane, we're going to damage those neuroprostanes. We're going to have more difficulty with memory. Okay, what about 8-OH? DG. Well, we talked about how that creates more DNA damage. When there's more oxidative stress in general, you're gonna have a lot more difficulty in terms of detoxification. And 8-OHDG is highly associated with cancer risk, but it's also associated with mitochondrial dysfunction. And two tissues that have a very high need for mitochondrial health are the brain and cardiac tissue. And both of those are so important in terms of mitochondrial health. Of course, we know this for cardiac tissue. We talk to our patients about how one of the major needs in terms of cardiac tissue is to produce ATP. The heart has to beat all the time, so we have to have adequate mitochondria. And so we'll use CoQ10 for that reason for cardiovascular disease, because it's going to help to drive that mitochondrial production of ATP. Well, when 8-OHDG is high, we know that mitochondria suffer, so it gives us a window into that. 8-OHDG, again, compromising mitochondria. Energy in the brain also requires good level mitochondrial function. And we'll look at some research that talks about elevations of this 8-OHDG being associated with more depression, anxiety, schizophrenia, and bipolar. So some other things that are looked at on there is your lipid that's most likely to form a plaque, which is oxidized LDL. So we know that when there's less glutathione, it's more likely to become oxidized. We know F2-isoprostane itself will oxidize LDL. And so that will gives us an increased risk for cardiovascular disease. But interestingly, oxidized LDL also damages neuroprostanes. In fact, there's even some autoimmune conditions like MS that they're saying they should redefine as a lipid disorder. So you see much higher levels of oxidized LDL in your MS patient. And when you have higher levels of these angry fats, F2-isoprostane, oxidized LDL, all your good fats get crunked up. And so your omega-3s really struggle to get incorporated into that myelin sheath. Your vitamin D really struggles to penetrate and create change at the myelin sheath. And so there's discussion about how we should really be thinking about the oxidation of lipids like oxidized LDL and F2-isoprostane in conditions like MS, to know that we are reducing the environment enough that those fats are in a nice, healthy state. Okay. So lipopolysaccharides from gut-based dysbiosis, bacteria that comes from the gut. This is a leading cause of non-alcoholic fatty liver disease. So it gets a mark there in the detox oxidative stress box. When we produce more lipopolysaccharides in the gut, they move from the portal vein, they get dumped on the liver. They cause the liver to be more fatty. We know lipopolysaccharides also damage tight junctions, so a major reason for leaky gut. Lipopolysaccharides decrease the activity of Treg cells, and those are the pivot point that keeps the immune system more in balance. So yes, it will increase autoimmunity, but decrease that innate immune function, which doesn't help us in terms of cancer prevention. Lipopolysaccharides can also oxidize LDL, starting that plaque former. They also can damage cardiac tissue. And if I'm in a laboratory model and I'm trying to induce depression and anxiety and memory decline, one of the major ways they do that is they inject lipopolysaccharides into the animal. Now, in human animals, if we have dysbiosis, we're creating lots of LPS. We don't need to inject it, but it will have those same outcomes, creating inflammation in the brain that makes it harder to focus, that decrease that cause a block in our ability to make neurotransmitters like serotonin, so that we feel more depression, we feel more anxiety. So zonulin also on this profile tells tight junctions to open. And when tight junctions open, everything floods in. The liver has to deal with that. That's why we're giving it a mark there in terms of a detox, but very strong gut marker, of course, associated with celiac, irritable bowel, IBS, but also associated with depression, because again, as the gut gets leaky, things flood in. That puts a stress on the brain as well. Zonulin will also tell the blood-brain barrier to become leaky. It has an effect there too, and especially this zonulin, where we're looking at serum zonulin, a very causative kind of issue there. And in fact, they've isolated a whole subset of the population with COVID long haul, and that the reason they're having brain fog is because their zonulin is higher, not because of a drop in dopamine or a particular neurotransmitter. But zonulin did go up in a subset of people with COVID, generally those that had more GI issues. And then it acts at the blood-brain barrier as well. And that leaky blood-brain barrier causes things to flood in. It causes more brain fog. So this is why zonulin can also be associated with memory dysfunction. Okay, this profile also has diamine oxidase on it, and that impairs detoxification, low DAO. It impairs because now the liver has to deal with more histamine, but when DAO is low, we make it in the lining of the gut. So it means the gut lining has become more permeable. Low DAO will increase more histamine, which drives us more in an autoimmune direction, giving it a check there in the immune box as well. And then higher levels of histamine can create more anxiety. So we put it over here in the memory CNS box too. We look at vitamin D on there. So again, we know that vitamin D decreases risk of cancer, decreases risk of cardiovascular disease, decreases risk of Alzheimer's. So getting a check in those boxes. CRP on here is a marker of inflammation. It's interesting that one of the major ways we produce CRP is when the gut becomes more leaky. We produce more IL-6 that sends a signal to the liver to produce more CRP. We know it's a risk factor for stroke, so it obviously gets a mark in terms of cardiac disease and memory as well. And hemoglobin A1C to see if you're glycating, because that crunking up of proteins causes issues in terms of conjugation with detox, causes issues with tight junctions. We know that above a 5.2 can be associated with diminished brain size, so getting a check there as well. So I think that this is a really cool profile. It combines the intestinal barrier assessment markers with the detox markers, and then gives some general wellness piece there too, so that we can put all of this together to have a nice functional wellness profile to kind of get, is this more of a gut patient? Is it more of a detox patient? And it helps us to know what direction to go in from there. And okay, so got so gladly send you some of this information afterwards. Now let's jump back into looking at some of the slides there. Okay. Okay, so here's what that oxidative stress profile looks at. And here we see some of that research walking us through the fact that when you see low glutathione, it's associated with depression, anxiety, bipolar, schizophrenia. And that's because, like we mentioned, glutathione is the primary antioxidant of the brain. And the literature said, there was a lot of successful studies out there giving things like N-acetylcysteine to improve levels. But they found that when they looked at glutathione and psychiatric disorders, depressive disorders, schizophrenia, bipolar, etc., generalized anxiety, that low levels of glutathione are associated with all of those states. And so when you see someone who's tried SSRIs or tried SNRIs or even amino acids that modulate neurotransmitters without much success, think about oxidative stress, because it's a major thing that shows up in terms of pathophysiology. And, when we're thinking about something like bipolar, for example, example, that this can be a really hard one, because do we want to use neurotransmitters that are more neuroexcitatory, like epinephrine, norepinephrine? Do we want to use and push more neurotransmitters that are more sedating, like GABA? Where are they at their manic or depressive phase? But maybe, rather than trying to push and pull too much, just calming the whole tissue down, reducing oxidative stress, just helping their own neurotransmitters to work better can be a really nice thing, because we're not risking making pathology worse. And it's an evidence-based thing that shows up in the literature in terms of improvement. So here we're looking at post-stroke and depression, and the higher your level. So they looked at people who had elevated 8-OHDG, and they looked at non-stroke subjects, and they looked at who after a stroke, if you also had the highest level of 8-OHDG, then this was the patient that was found to be correlated in terms of depression. And so again, thinking about that mechanism there of those people that we know that we want to do things that are anti-inflammatory post-stroke. So people that are having more inflammation are more likely to be depressed, and that's reflected in markers like 8-OHDG. So we know how to fine-tune their antioxidant support. And so we will use, again, things like sulforaphane to increase NRF2, because it increases glutathione peroxidase, it increases production of glutathione. And as we increase levels of glutathione, interesting, so here again, we're looking at depressive disorders. And so you can't always just base depression on overall levels of neurotransmitters, because they can be doing different things in different parts of the brain. So what they saw when you reduced oxidative stress by increasing NRF2, which sulforaphane does, you actually saw a decrease in dopamine and serotonin, but an increase in glutamate in the prefrontal cortex. So sometimes we want more a balance of neurotransmitters, and our antioxidants and getting them in the right levels are what do that. And again, here they're using LPS to induce oxidative stress in the brain. We know that the mitochondria, that it impacts brain function and cognition. Here in this study, they talked about, we know that that one of the major reasons things like estrogen helps with cognition is because it minimizes reactive oxygen species at a mitochondrial level, helping the mitochondria to make more energy. And we know the more that we can improve mitochondrial function, the more we can improve the aging process in general. So making sure that antioxidants are in the right level for that patient for controlling their pathology, it really takes the guesswork out of it. And so here we see that 8-OHDG goes up. It is the most common thing to see go up when there is more problems with mitochondrial DNA. So higher levels of 8-OHDG in the mitochondria are associated with more mutations and deletions, more apoptosis. That's not what we want in terms of anti-aging. We want more mitochondrial biogenesis. So as we decrease 8-OHDG, we saw an increase in mitochondrial DNA content that was intact without deletions, and so improved mitochondrial function and survival, which tracked with improvements in 8-OHDG. Here we see 8-OHDG tracked with MS. What it said was the people that went on to get stronger MS symptoms were the ones that had higher levels of 8-OHDG. And so here looking at some of the synergy between antioxidants like green tea and resveratrol, and that we can measure markers of oxidative stress to know if we're getting enough of them. Here seeing that higher levels of 8-OHDG was correlated with Alzheimer's disease, and you also saw lower antioxidants like CoQ10. So we know in Alzheimer's that there's, you might even go not only just 300 milligrams, but some people even advocate using 1,000 or 3,000 milligrams. Well, that can be quite cost prohibitive in terms of CoQ10. So if we can measure markers like 8-OHDG, it can help us guide, well, do we really need to push the upper end of that range? Here again, seeing 8-OHDG go up and things like depression and chronic fatigue syndrome. And just a little more about F2 isoprostane. It's an extremely reliable marker. It correlates with good levels of neuroprostanes like DHA. And when F2 isoprostane, DHA will not get incorporated into neurons like we'd like to see it. It helps to, if F2 isoprostane is high, it decreases membrane fluidity. Well, that means we can't get nutrients in. That means we are struggling to get metabolic waste out. So it exists as an oxidative fat and plaques. Higher levels correlate with neurologic conditions, cardiovascular conditions, and even cancer. So a great marker of oxidative stress. It's very reproducible. It's not affected by lipids in the diet. It's something that we make endogenously, unlike other markers of lipid peroxidation like MDA. It directly creates pathology in the body. And again, as we examine this relationship, antioxidants like melatonin decrease oxidative stress in the brain. But how do you know if it's too much oxidative stress? And looking at these markers can be key for that. Here again, N-acetylcysteine, improving conditions like schizophrenia. And so that was because it was a glutathione precursor. And again, what you see is normalization of various neurotransmitters in the right area. So NAC being utilized because it has this modulatory effect, depending on where we're at in the brain, to decrease oxidative stress and improve neurotransmitter activity in those various areas. So in terms of this patient, there were some neurotransmitters that were lower in him. We treated some of the thyroid. We thought about the mitochondria piece because of some of his lower levels of glutathione. He had some hormones that were off as well. So we used some of that too, folded in some omega-3 fatty acids, some B vitamins, looked at his food sensitivity testing, addressed things based on that. And what we ended up seeing is that really his neurotransmitters weren't that off. It was the glutathione that was the big thing that was off for him. And as we saw improvement there, we also saw remission of symptoms that he was experiencing, hearing voices, etc. And so NAC helping with some of that, decreasing angry fats like oxidized LDL, and then finally, the resolution saw some stress response. Again, check out our adrenal stress testing. We're bundling that with our hormones and our thyroid, so you can get all of that together. So finally, what we saw, treated some gut-based intestinal issues. He had some yeast there that was causing him to be more inflammatory. And then ultimately, what we saw is we coursed him through treatment, removed foods that he was sensitive to. We got to a place, and we know complement is also higher in depression. So you want to use food sensitivity testing that's also looking at complement, because that drives the pathophysiology as well. And then what we found is that as we got his glutathione up, this is when he said, you know what? Resolution of my OCD, my depression, my anxiety, and increased ability to make decisions, more increase in mood and joy and energy, and I have dreams and inspiration. And so I know for sure that it was the oxidative stress that was the biggest deal for him, because he began to try to minimize things in his treatment arsenal. And when I pulled out the NRF2 activating ingredients, the sulforaphane, the curcuminoid, the resveratrol, and the green tea together, he started to have a recurrence of symptoms. And we saw the oxidative stress creep up again, pulled it back in. And what we know is that just a low dose of this, one a day, is now something that he needs for prevention, because when people with these type of symptoms tend to have brains that are more fragile in the presence of oxidative stress. So by being able to measure and test, this allows us to know what can we get to in terms of the lowest amount of a regimen to keep somebody where they need to be. And it also keeps us from missing an important part. These conditions are not always neurotransmitter issues. They're not always methylation issues, but it's the oxidative stress itself that makes the neurotransmitters not able to work as well. And so when we're trying to put the body in a reduced state where it functions better, whether or not we're talking brain health, cardiovascular health, gut health, or detoxification, understanding that our major intercellular antioxidant is where it should be goes a long way in terms of making tissue healthy. So I want to go ahead and make sure that we have answered any questions, and I'm not seeing any new questions in the Q&A. I want to say thank you guys for hanging out with me today here at Precision Point Diagnostics. Like I said, check the homepage. We're going to do this. We're doing Q&A every month. We're going to have a webinar every month. So tune in and join us. Also watch your email in terms of some of the new offers from Precision Point. Thank you very much for sharing your time with me today.